one of them, the transverse process, have hole in it. We call them as foramen, transversarium or transverse foramen, which is present on the transverse process. Likewise, any vertebra, it has got these parts, like it has a body, it has process. Process are of two types. One is on the posterior side, on the dorsal side, we call them spinous process. Transversely running, transverse process. Joining between them, we have this lamina, which is joining this particular transverse process with the body. This one is this one is pedicel. Sorry, I correct. Joining with this transverse process with the body, we have these pedicels, which is present in here, like on the sides, right side, left side, and this one is a lamina, which is joining the spinous process with the transverse process. This one. So this is lamina, and this is pedicel, and this is body. So these are the piece of bar or bone which is present in the central part. Joining between these particular bodies, we have this space we have known as, which is filled by this cartilage. We call them as intervertebral disc. Now, easy to identify this particular piece of vertebra is because the transverse process, each of them have holes. See that? Whatever the cervical vertebrae are there, they have the holes, easy to identify. From a distant side looking at them, easy to identify them. So, this is a cervical vertebra. Cervical vertebra can be typically divided into two parts, typical and atypical, something which looks similar, something which looks dissimilar. So, you see that there are 7 cervical vertebrae are there. We number them 1, 2, 3, 4, 5, 6 and 7 like this. So, which one looks similar and which one looks dissimilar to you? Separate out the dissimilar one and keep the similar one. Good. So, these three are not likewise these 4, right? This one we call them as typical, this one we call them as atypical. Atypical out of this one is near typical, but this is longer process which is having. So, this one is in middle of something. So, this one is atypical, which is like a grossly atypical, right? How this is atypical? This one have no body, only ring. This one has got a body and a projections. So, these are two is similar. This one have got body, have got processes, but this is too long. Compare with this one, this is spinous process. This spinous process of this particular vertebra have got 2 spikes, we call them as bifid, 2 antennas, right? 2 of them are there. So, this one have a single and projected. So, this one is the longest one and projected and single spinous process, which is dissimilar kind of like compared to this one, right? So, these vertebrae have got same features, all of them. They are cervical vertebra. So, these are all cervical group of vertebra. Amongst the cervical group vertebra, these 2 are atypical cervical vertebra with the 7th one. So, this one is C1, C2 and this is C7, and this one could be anything, right? Between this particular C3, C4, C5 like that, right? Now, out of these 2 we need to identify specially. This one is C1, we call them as, give a special name, we call them as atlas, and this one C2, we call them as axis. So, C1 into which the brain or the skull is sitting on it. The occipital bone is sitting on this particular bone whenever we are taking this particular bone in consideration for the joint formation. So, this have got laminas. This is called anterior lamina, this is called posterior lamina or bars of bone tissues, but no body. Body is vanished over here. We have this one articular facet, superior articular facet, inferior articular facets. Transverse process is there. Have hole in them? Yes. This is spinous process, which is do not have this typical like a projected spines on it, like bifid spines are absent in here. This canal which you seeing here is the vertebral column or vertebral canal, which is going down to form the vertebral column. So, together it forms a canal through which the spinal cord passes. So, this one is C1 cervical vertebra, easy to identify, having no body, and this one is anterior border or anterior posterior border. They have nodules in there. We can see that this is having an internal nodule which is present on here, what we call them as facet. Now, this facet is again important for identification as well. Now, this one is C1, this one is C2. How we identify? This is a body. This is what you are seeing here. This is we are seeing here is lamina. This one is pedicel and the transverse process. Small pedicel and small transverse process with, of course, hole in it. Superior articular facet, inferior articular facets, right? Both of them are there. In top here, this is a projections which is moving up. We call them as odontoid process. We call them as odontoid process, also known as dens, D-E-N-S, dens, D-E-N-S, dens. This one we call them as dens or odontoid process. What is dens? Dens is the separated part of the body of the C1 vertebra. This C1 vertebra body is separated out from here while developing, and this is separated out and planted on this body or superior surface of the C2 vertebra. That is why this came here and making a projections like this. And this particular projected part we call them as dens. Now, dens is projected into this particular C1 and C2 like this and making a joint over here. As this dens is articulating over here, it makes a friction point over here. That is why we have a circular facet for it. So, this circular facets on the inner ring of this posterior rim of this particular C1 vertebra, this articular facet is for articulations of the dens or odontoid process. Clear? That is why we have a mark on it. So, this is how we are going to identify the anterior posterior. This is posterior, this is anterior, and this is the dens, how it is placed like this. So, this is whenever you are making this as a column, we identify it like this, C1, C2, and in top of that we have this particular skull bone resting on it. Now, this particular bones makes a joint. We call them as Atlanto-occipital joint and Atlanto-axial joint. That means axis and atlas. Atlas and axis making a joint, we call them as Atlanto-axial joint. And this C1 joining with this occipital bone, we call them as Atlanto-occipital joint. These are the two different types of joint that we are going to study in theory. I am not going to take long terms discussing about. We have ligaments joining, binding this particular dens. One ligament which is particularly important for us, like for this particular joint, is running like from this side to this side, holding this particular dens. We have a ligament, we call them as transverse ligament. This ligament transversely running and holding this dens with this particular C1 vertebra, we call them as transverse cervical ligament or transverse ligament of the vertebra. Clear? What is the purpose of transverse ligament? They are holding this so that this particular joint is remaining united, so that whenever you are making a movement, this thing remains in place. Now, the types of joint movement which is taking place in this here, we have this flexion extension and lateral rotation, which is we are taking this little bit of lateral flexion and medial flexion also is permitted there. So, whenever you are going to study the joint, we will talk about detail of the movements of this particular joint. So, this is about this particular bone that we are going to study in general, C1 and C2, and what is this and what is that, and superior inferior articular facets, which part we call them as pedicel, which part we call them as lamina, and how we are identifying this as a cervical vertebra, how we identify them or separating out with this rest of the vertebra, what are the typical features of them. Now, this particular cervical vertebra is thin, as you can see the canal or the cavity within this particular vertebral column or canal over there is large. You see that this is large, the cavity is large, the bone is thin. If you see this particular lumbar vertebra, it is triangular and narrow. So, this cavity of this particular vertebral canal or column, which is wider here and narrower down. So, this is the widest part of the vertebral column. As this particular spinal cord gets down, this particular region is quite wide. As we go down to the thoracic region and then to the lumbar region, the canal size or diameter shrinks. So, we get this particular diameter of this particular region is quite big out here, and we have the same muscles and same ligaments are attached to it, supraspinous, interspinous, then we have the ligamentum flavum and all these same ligaments which are running over here. I am not just like spending time talking about those ligaments, because in any ways you are not going to remember. So, pointless to study and talk about it. I do not know how we are planning to pass, but you plan it, it is not my exam. So, if you are not answering, you are not going to pass in the examination. I am not going to do anything extraordinary to make you pass. So, it is your work, your job to make yourself pass. So, coming again about this particular vertebra, typical, atypical. Identifications of the cervical group is identified by this particular transverse process having hole. We call them as transverse foramen or foramen transversarium. Through here, blood vessel passes through this particular right side and left side of it. We call them as vertebral vessels with the sympathetic plexus. And then we have this vertebra, which is typical one, having body and having process. Spinous process on the posterior side, transverse process over there. Joining then, we have the pedicel and the lamina joining these two processes with the body, right. The bodies are joined with each other by this intervertebral disc intervening between them, and this particular thing is a secondary cartilaginous joint. Now, talking about this particular vertebral features about atypical vertebra, we have C1, C2 and C7, which is atypical. So, this one we call them as C1 cervical vertebra, which have no vertebral body. Rest of the vertebrae which we studied have bodies. This one is the only one lost with body. What else it has? It has anterior lamina or posterior lamina of circular ring. It has articular facets, transverse process, lamina, everything is there except that particular missing body, and it has a facet or internally to articulate with this dens or projections of the vertebral body or C2 cervical vertebral body. Now, this one we easy to identify, again atypical one, because it has everything together. It has body, it has transverse process, lamina, pedicel, spinous process, foramen, transverse, and everything. Along with the body, superiorly it has a projected piece of bone, which is a part of this particular vertebral body removed from C1 and stuck in here, and it is projected like a finger-like projection. It call them as Odontoid process, also known as dens. Dens is articulating with the C1 cervical vertebra. It has articular facets on the posterior side as well for the articulations with this particular vertebral bone. Whenever this particular body and this element is articulating, it is bounded together by a transverse ligament. We call them as হয়ে যাবে এক্ষুনি আসছি, তুই ওই অত কিপটামি করে চাটা করিস না, একটু ভাই তুই চায়ে পাতা দে, ঠিক আছে? তো গার্লফ্রেন্ড পালিয়ে যাবে এত কিপটামি করলে। Transverse process joining over here is a transverse cervical ligament, right? So, this is how we are identifying this. Now, whenever you are studying here, we have some features like on here we have this particular vascular structure rests on here on this particular part. We call them as the, we have a blood vessel, we call them as vertebral vessels. That means artery and vein. Artery and vein, what happens here? Vertebral artery runs through here and gets out of this particular part and rests on this vertebra and gets through foramen magnum and enters to the brain. So, this particular vertebral artery and the vertebral vein rests on this particular anterior pillar of this particular bone. Where you see the marks are there, these particular marks are for lodgement of these vertebral vessels. They rests on it and then it enters to the brain through the foramen magnum. Foramen magnum গিয়ে brain এ supply করে. So, we learned about the circle of Willis, right? The circle of Willis is formed by this central anterior part and the posterior part. There are two components of the anterior part is formed by the middle cerebral artery and anterior cerebral artery. Posterior part is formed by the posterior cerebral artery. Posterior cerebral artery is formed by the union of the vertebral artery. There are two vertebral arteries are there, right and left. Right and left joined together makes the basilar artery. Basilar artery splits again, form the posterior cerebral artery. Posterior cerebral artery sends a branch, we call them the posterior communicating branches. So, this vertebral artery runs through this vertebral foramen, runs after coming through this particular vertebral foramen, it has to go to the brain. How it will be going to the brain? Through the foramen which is present in the skull. Which big foramen in the skull we have? Foramen magnum. So, once it gets out from the C1 vertebra, then it rests on here and then anchors to the under surface of the brain through that foramen. Then it enters to the brain. So, we call this vertebral artery have got few parts. We call them as vertebral artery part 1, part 2, part 3 and part 4. Part 1 before it enters to the vertebral canal. Part 2 which is present within this particular vertebral canal, which is running through between this particular cervical vertebrae. That means it is running through the C6 cervical vertebra, climbing up and getting out of the C1. Once it getting out of the C1, this foramen, it rests in this bar and then projects to the third part, which is going to the brain before it unites to this formation of the basilar artery. We call them as third part. So, right and left vertebral artery goes like this and resting on this particular bar of the C1 vertebra, then it unites. Then we call them as basilar artery. Then it splits. It runs in the pons, dorsal surface, and then it splits into two parts, right and left, posterior cerebral artery. So, this is the third part of the vertebral artery, rests on it. Then we have the fourth part, which is getting inside the brain, which splits in here. We call them as fourth part, third part, second part, and before it enters we have the first part, which is coming from the branches of the cervical trunk. But anyway, this is what we discuss about. Too much knowledge produces nothing. So, you should be able to identify this typical vertebra with atypical vertebra. Other atypical vertebra, this one, we call them as C7. It has got everything together, which is having body, which has got processes, transverse process, lamina, pedicel, everything together. But thing is that the spine, you look at the spine, which is different. That means this one you see that spine is bifid. That means two lips are there. Here we have that like spines like the dorsal vertebra, projected and long. So, this one you can feel it here. This one you can feel that the bump which you are seeing here back of the neck, this is C7 cervical vertebra spinous process. This is the prominent one which you can touch here. So, this one which you are feeling here, this is basically looking like thoracic vertebra. How it can be separated from the thoracic vertebra? By this hole. Thoracic vertebra do not have hole. What else the thoracic cervical vertebra has? Thoracic vertebra has these facets. What the facets are there? These facets are articulations of the ribs. So, ribs facet or costal facets are there in the thoracic vertebra, which is absent in here, whereas it has this transverse process pierced with the hole, this one. Through this hole, we have the vascular structure runs through here. What vascular structure? We call them as vertebral artery. Now, we have vertebral artery, we have vertebral vein. So, two structures are there, vein and artery, they runs together. Now, there are little difference are there. You cannot remember this little difference unless until you understand the significance of this. Now, the arteries comes from the branch of the arch of aorta, eventually comes from the heart and enters to the vertebra. How many vertebra in the cervical region we have? 7. C7, right? Cervical vertebra, we have 7 cervical vertebra. So, C1, C2, C3, C4, C7. So, this particular vertebral artery enters to the transverse foramen of C6, bypassing the C7 transverse foramen. So, through the cervical foramen, transverse foramen of the C7, the vertebral artery do not enter here. It enters to C6 and then climbs up. So, if you just like look at it, 1, 2, 3, 4, 5, 6, 7. So, we see this one is 7 cervical vertebra. So, this particular vertebral artery bypasses here and enters to the C7 transverse foramen like this, bypasses a C6 cervical transverse foramen and enters to C7, C5, C4, C3, C4, 2, 1, then brain like this, bypasses the 7th one. Whereas, this particular vein, the vertebral vein, that runs to C1, C2, C3, C4, C5 and C7. So, the difference between the C7 and C6 is that C6 transmits vein plus artery. So, 6 is everything, 6 to 1 is everything and only 7 is the vein only, artery do not enter there. It bypasses the C7 and enters to the C7. We do not know why, but it runs like this. Clear? So, see this typical atypical cervical vertebra can be separated with easily with the lumbar and the thoracic vertebrae, and C1, C2 needs special interest because they forms a joint Atlanto-axial, Atlanto-occipital, they have the movements, they have the ligaments present in here. Rest of this particular vertebra, the ligaments whatever it has, it also has the same ligaments except one special mentioning about transverse cervical ligament, which is present in between C1 and C2 holding the dens or odontoid process. The transverse cervical ligament is of importance. When you learn in forensic medicine, you will learn more about this again and again, right. So, run over the ligament like interspinous, supraspinous, ligamentum flavum, etc., whatever the ligaments, that is posterior longitudinal, anterior longitudinal and transverse cervical is special out.